So one of the things that you say that you're a big fan of because it works is spinal cord stimulation. What is it? How does it work?
Well, spinal cord stimulation, I call it a pacemaker for pain. So we're able to use a device to implant close to the spinal cord to block pain signals. Basically replaces a pain signal off from wherever you're hurting to the brain, replaces it with the stimulation.
Like it kind of interrupts a signal to the brain?
It interrupts the signal of the pain to the brain.
So you don't feel the pain?
Correct. And we can map it to different areas. So it works really good for low back pain. Those who have had surgery, it's called failed back surgery syndrome. They got the surgery and they're still in pain. We can do this device to block that pain. Or those patients with CRPS, horrible syndrome, they lose function of one of the limbs and this improves. Those patients get osteoporosis localized to that limb, even that reverses. So spinal cord stimulation helps very, very well.
And it's just an electronic signal pointed at the nerve that you put it like a little lead wire in there.
Yeah, it's a minimally invasive
and then the brain doesn't know it's in pain.
Exactly.
And this could be used for back pain, neck pain, many different types of pain.
Yes, neuropathic pain, which means patients with diabetes, that they have the neuropathic pain, the burning feet. This has helped them. Visceral pain, patients with pancreatitis has helped them as well. So we're applying it more and more because it's simple, just blocks the pain. So unlike surgery, you actually get to test this device. We do an outpatient procedure, we implant the lead, you go home with it, 2 weeks, and if your life is changed significantly, then we actually proceed with the placement.
And then how long can that last? That means how long this implantable device, how long can it block the signal to the brain?
15 years, 12 years, and then because of the battery running out, and then we just get to replace it, so it continues to help you, but it can be a permanent...
It's called, what do you guys call it? Like the doctors?
Is
it called neuromodulation?
Neuromodulation, exactly. So we are modulating the neurons or changing the way that the signal that they are sending to the brain.
One of the things that we're talking about off camera is a lot of people could benefit from this, but they're afraid of it because they just hear the word surgery, even though you're just implanting it right into the skin, and they panic or they don't want to do it. Can you speak to that?
Yeah, that's one of the biggest barriers is that they think is this complex procedure, but it's outpatient. They get to try it with just the lead being injected, like having an epidural injection, but instead of putting medication, we just pass the lead. So it's very simple.